All right, it's Dr. Jones. Today we're reviewing a case. This is a 38-year-old female who had a significant amount of weight loss, who really didn't want a tummy tuck. Her BMI is 26.1. She weighs 182 pounds, and this is 4 months post-op. So here you can let's look at her before picture. You can see she has great skin quality, and you can see that she has widening of her flanks. She has some adiposity or some fat deposits of her belly, and a telltale sign that she has excess skin. You can see that there's skin overhanging her belly button, and if she bent over, she would be able to pinch her skin, and it would kind of highlight the excess. And then let's go to her back. Same thing. She has some fat deposits, specifically in her lower back. It seems to be heavier, and she also, you can see she has some deflation of her buttocks, which is often very common after massive weight loss. So again, this is a patient who did not want to undergo general anesthesia, and she did not want a tummy tuck. I recommended a tummy tuck. I actually recommended a circumferential body lift. However, she just did not want to have a big operation. So here is her results. This is 6 months after her original surgery, and you can see her abdomen is flat. We were able to nicely take in her waist, and a transition from her waist to her hips. We got a nice little hourglass shape. Now, if you really look closely at her abdomen, unfortunately, she still has the hooding of her belly button, which, you know, we couldn't fix. Only way to really get rid of that is to do a tummy tuck. And then you can see part of the reason the skin kind of looks pressed is she had just taken off her garment. So some of those lines are actually from the garment. But you can see we were able to really take in her waist. And then go ahead, let's look at her back. Let's look at the before. Oh my gosh, look at that. Even though, see, we didn't even do anything to her butt, but her butt looks more shapely. Why? Because we addressed the fat in her lower back. She has a great result. I'm happy we're able to help her. She's more confident, and she feels like her old normal self. Now, exactly what was done, she had Awake Lipo 360 with Renuvion, which we use Renuvion to help tighten the skin. And again, this is at 6 months. She was a great patient. And one thing that I recommend for all patients, well, actually several things. So one, you need to wear the compression all the time. Usually after 1 to 2 weeks, we'll switch from stage 1 compression to stage 2, and basically it's just tighter, and it just provides more compression and helps with the shape. The other thing is post-operative massages to help with the fluid drainage. And of course, you want to make sure you have a great source of protein. You want to stay hydrated, and just in order to maintain your results, I mean, a big part of that is nutrition and wellness.